Hi, welcome back to the show. Well, keeping us all up to date with the latest in cosmetic surgery procedures is the goal of Dr. Jeffrey Raval. He's here again to discuss newer products that have made cosmetic surgery a lot more affordable. Dr. Raval is offering a great new technique to rejuvenate your skin, and today he's brought some really great new news about injectable fillers and the liquid facelift. It's the same great filler, but there's much less pain during the process. Dr. Raval is joined with Kelly Porter Amato, a client and staff member. Hi, you guys.
Hey
Good
there.
morning. Nice to see you.
It's good to be back.
Wow,
nice
look
to
at
see you.
all the great stuff that you brought. The greatest
Yes.
fear I think people have with cosmetic surgery or a makeover is the pain.
That's correct. You know, it's really, that's the first question people ask. Does it hurt? How does it feel when it goes in? And you know, that's probably the biggest thing that holds people back. The second thing that holds people back also is just a poor result. And that's why we always recommend you go to someone who's very experienced, who knows what they're doing. But in the realm of pain or discomfort, it's just gotten a lot better. And really what's happened is the major fillers, and we like to use all various fillers for different areas of the face, they have all recently received FDA approval to add lidocaine to their injectable. Lidocaine is a lot like Novocaine, like when you go to the dentist to, if you have a cavity or something like that, to numb up the area. And lidocaine does the exact same thing with the filler. So as you're injecting it, it can actually numb up the area.
So it numbs, like if you're injecting between the eyebrows or around the eyes or in the cheeks, it'll be numb.
Right. So
Okay.
as you're putting the filler in, it actually numbs the area. And lidocaine works extremely fast. Some reports show that it can take effect and numb the area in as quick as 3 seconds.
Wow, doctor, pop open that syringe and give me some right here between the eyebrows. Let's do it right now. But you've also added different ideas
Right.
to help the process through.
Right. So other concerns or other things that can happen with an injectable is bruising. And then also you can get some unevenness. It can be lumpy or bumpy, and that's probably the biggest complaint that we hear from other people when they had injections other places. So we've done two things to address that. One, we've added epinephrine. Epinephrine is like adrenaline to the filler, and this is only if it's indicated and it's in the right patient, but epinephrine actually squeezes the blood vessels down, and by squeezing them down, they're less likely to bleed, and if they're less likely to bleed, they're less likely to bruise.
Okay.
And then we've also added a little bit of saline to the injection, which tends to smooth it out. It tends to come out in a much nicer, smoother way, which decreases the amount of lumpiness that you can get from the fillers.
Okay, and you're going to show a demonstration here today.
That's correct.
What are you going to do, all three?
So these are the main three products. And again, different fillers work great in different areas. So we have Restylane and Juvederm, which is made by Allergan, and then Radiesse. Juvederm's done a nice thing where they've actually added the lidocaine in it already. So you open the package, it's already in there. The other two, you have to mix it in. And what we have today is we have Radiesse. And so this is the Radiesse, and this is the original syringe that it comes in. And I've already transferred it over to a syringe where I'm going to actually mix it with the lidocaine. So here's the lidocaine with the epinephrine and a little bit of saline. And what we do, and we do this in the office, is we actually get the two products and then we actually just mix them together. So you can see how it's going into the syringe, and now they're all together in this one syringe. And if we just go back and forth nice and gently, we get a nice mixture of the Radiesse with the lidocaine with the epinephrine.
And again, the reason why you're doing that is because it cuts down, it numbs the pain.
Numbs it, reduces bruising, and you get a much smoother injection because we're giving the same amount, but we're diluting it. So it's a much thinner. And as it goes into the body and the face, it comes out thinner. For physics reasons, it's actually easier to inject in the original syringe. So what we do is we actually transfer it over to the original syringe. So I'm transferring this back over to the original Radiesse syringe. And then now we're ready to go ahead and do the injection.
And where are you going to inject?
Okay, so I like Radiesse. Radiesse is a little bit of a thicker injection that lasts about 1.5 years. And it's a great deeper injection. So I like to inject it as a volumizer into areas that need just more filling versus an individual wrinkle. So for Kelly today, she's what I call the Colorado athletic thin person who's got no body fat. She really has some loss of volume in her cheek area that would be a great area for the Radiesse to go. So that's where we're going to put it.
Okay, so you're going to do this live.
Yes, we're doing this live.
We get to see your reaction too, to see if it, because like again, when we started out this segment, the number one concern a lot of people have, it's going to hurt.
It's going to hurt.
But if she can sit here and do it live.
Yes. So we're going to do it now. She's already been cleaned. A lot of people,
Okay.
just to save time. And then Radius is great. They provide a very nice, smooth needle, sharp needle. Believe it or not, the sharper, the smoother it is. So they provide us with one of those needles in the package. So I'm loading that now.
And how long does this last again? You said a year and a half?
Radius can last about a year and a half, yeah.
And does it depend on how much you put in and the type of person, I guess?
Some people with higher metabolism, like Kelly, we oftentimes say that it may not last as long.
Okay.
But at least a year for Kelly.
Okay.
Okay, ready? You know, other key things, before I start, I know,
Yeah.
let's see. There are some blood vessels, and knowing the facial anatomy also helps me reduce bruising. Just looking at her closer, I don't know if you guys can see it, but just from experience, I can tell you that there's a little vessel going right there and right there. I don't know if you can see it in HD. So we're going to just avoid those areas.
Okay. And that helps, again, reduce the bruising.
Reduce the bruising. So again, place it in.
Right. Not
And then I'm
even
just
a
kind of-
wince. Wait, I don't want to make you smile. Don't smile.
Yeah.
I'm not sure if you're supposed to or not. Sorry about that.
Now, and you can see, like, again, minimal bleeding.
Okay.
Very comfortable. Goes in very smooth.
Immediate results, doctor?
Results are immediate.
Okay. And how many injections does it take? I guess it depends on the person again, right? What
Yes.
they need.
You know, it depends on what they need. Everybody's individualized. I like to give a small amount at a time and just kind of massage it in to make sure it's nice and smooth. This is kind of a unique area. When we're close to the lips and the mouth, we can actually, I can actually put my one finger in the mouth and one on the cheek and kind of bi-digitally massage it in.
Okay.
But you can see right here, now we're only giving her half a syringe here, but as you can see, I don't know if you can pick up, but she's already starting to get some fullness here,
Making
some
a
correction.
difference. Yeah, which again, because as you grow older, you lose the weight in your face.
Right.
It starts drooping down. So when you add a little volume, it makes you look younger and youthful and rejuvenated again.
Yeah, correct.
Okay.
And on the show, I've talked about it before, and as we age, we used to think it was all gravity.
Right.
Gravity pulls everything down. Now we're realizing that it's also volume loss. The analogy I like to use is we all go from a grape to a raisin as we get older. And really, this is kind of to replenish that. Now, there's some people think, well, if I'm losing fat, why can't I just inject fat? Well, again, in Colorado, the biggest problem we have is that people tend to have really low body fat, so there isn't much to get. So that's where the fillers come in. And it's a much simpler procedure, too. And now that we're finding that fillers last, so we're all done.
Okay, and we have some pictures here that we're going to take a look at, but I want to mention again that lasts like up to a year and a half. And obviously, you feel good because you didn't wince at all. So thumbs up, Kelly.
Yeah, it was very easy.
Okay.
So here's some before and afters. Now, these people also had other things done, some laser peels and Botox. But one of the key things for this patient was that she had filler around the lips, what we call the nasolabial folds, and around the eyes, and even to the cheek area. Again, this patient is a marathon runner, likes to run a lot. Another patient, again, thin face. The thinness around the eyes actually causes that baggy or the dark circles around the eyes. And so if we add filler into the grooves of the eyes, you can see here that it really takes away the tired look. We also put a little bit into her lips, as you can see in her folds, and into the jawline. Here's a patient, again, a lot of sun exposure. She had some laser peels also, but we also gave her a lot of filler all over, face, cheeks, lips. Again, and these were all in-office procedures. None of this is surgery. We did all this in the office with minimal downtime. And again, the great thing about it now is that it's just gotten a lot less painful because we're adding lidocaine and it's got FDA approval.
Immediate results. Nice job. And I'm going to tell them about a special that you have for Colorado and Company. Thank you for coming on the show.
Thank you.
Again, Dr. Jeffrey Raval.